Hey there, I'm Whitney Morgan, Hashimoto's coach, gluten-free warrior, and creator of the Thyroid Reboot Method. Maintaining adequate vitamin D levels when you have Hashimoto's is pretty important, but the information out there can be confusing. In today's video, I'm going to explain why vitamin D is so important for you, how to decide if you need a supplement, and at what dose. But before we jump into things, go ahead and hit that subscribe button and the little bell next to it so you'll get notified the next time I post a video. I've worked with dozens of women with Hashimoto's, and most of them continue to complain of symptoms even after they've been on thyroid medication. And one of the most nagging symptoms is continued fatigue. And quite often what we discover is that these women are deficient in vitamin D. Vitamin D plays an important role in balancing your immune system. And if you know anything about Hashimoto's, you know that when your immune system is out of balance, you're more susceptible to a Hashimoto's flare. Research has also shown that vitamin D plays a role in the prevention of autoimmune disease, and it's been well established that women with Hashimoto's tend to have low serum levels of vitamin D. So how do you know if a vitamin D deficiency is an issue for you? Well, you need to get your blood levels checked on a regular basis, and that's a pretty simple test. But most importantly, you need to make sure that your vitamin D levels are in the optimal range. And keep in mind that what is considered normal isn't necessarily what's best for your thyroid function or for your immune system. Have you experienced an improvement in your Hashimoto's symptoms after starting vitamin D supplementation? If so, give me a thumbs up emoji in the comments. Okay, so let's talk about what exactly is the right level of vitamin D that you want to shoot for. The standard reference range for vitamin D varies from lab to lab, but in general, it's somewhere between 20 and 100 nanograms per deciliter. Now that's a pretty wide range, but most functional practitioners agree that your levels should be above 50 nanograms per deciliter if you have Hashimoto's or any other autoimmune disease. So don't just take it on faith when your doctor says your vitamin D levels are normal. Make sure you look at the results yourself and that your levels are above that 50 nanograms per deciliter threshold. Now, if you find that your levels are below 50, then you might want to consider increasing your consumption of vitamin D-rich foods like salmon and eggs and haddock and mackerel and cod liver oil. And you also want to consider getting small doses of sunlight throughout the day without the use of sunscreen. When it comes to supplementing with vitamin D, your dose really depends upon how much ground you have to make up. And it's best to work with a functional practitioner to determine the dose that's right for you. But generally speaking, when you're climbing out of a vitamin D deficiency, you usually need somewhere between 5 to 10,000 IUs on a daily basis. Once you get your vitamin D levels and what I like to call the sweet spot, somewhere between 60 and 80, then you can transition to a maintenance dose, somewhere like 2 to 4,000 IUs on a daily basis. But when you're supplementing, you absolutely need to make sure that you get your vitamin D levels rechecked on a regular basis because you don't want your vitamin D levels to get too high. To learn more about my thyroid reboot method and how to rebuild thyroid function from the ground up, just click on the link that I've posted in the video notes. Now, if you're watching the IGTV replay, just head to my bio link and you'll find some more information there. Thanks for watching, and if you found this video helpful, you can let me know by liking it, subscribing to my channel, or sharing it with a friend who's got Hashimoto's or any other autoimmune disease. And as always, if you have questions, just drop them in the comments and I'll do my best to answer each and every one. I'll see you next week. Bye.